Should your primary care doctor write you for opioids if you're in pain and you trust this doctor and they've worked with you and they understand? I always tell patients I have no problem with that and I welcome it. However, the analogy I would use is if you had a blockage in your heart, would you never see a cardiologist and have your primary care doctor just write you for a beta blocker or a statin or any other medication that protects your heart? No, you would go to a cardiologist, you would get a full evaluation, you would see what they need to do, whether it's a stress test, an echo, what they need to put in stents versus just medication management. And once you get to a point where you're like, okay, I've had my thorough eval with a specialist, I just need to be on a standing dose of this cardiac medication, yes, your PCP can write for it. So do the same thing with pain medicine. Go to a pain specialist, describe your pain. You don't need to necessarily follow every one of their recommendations, but you should know what the recommendations are. And if after that you come to the conclusion that, I just need to be on a standing dose of tramadol or a standing dose of oxycodone and my primary care doctor can write for it, that's fine. But you owe it to yourself to at least see the specialist who has gotten a lot of training in this area and is in tune with this area, is doing continuing medical education in this area, going to conferences in this area to put their eyes on your problem and offer you the best treatment possible. If you want to learn more, please drop the word doctor in the comment section below.